Hi, I'm Dr. Robert Silverman, Amazon best-selling author of Inside Out Health and host of Proven Health Alternatives. The following episode is with Dr. Stephen Weiniger, and he speaks about the importance of posture, but the true importance of strong posture. Hey everybody, Dr. Rob here, Proven Health Alternatives. I've got a great guest in Dr. Steve Weiniger. Hey, Dr. Steve.
Dr. Rob, a pleasure to see you, my friend.
Oh my God, I am so happy we finally got you on here. We're going to get to talk about posture. This man is without question an expert in posture. I'm standing as tall as I possibly can just thinking of you.
That's the name of the game. It begins with awareness, Rob.
I know that you're a tough guy to get on podcast. I appreciate you taking your time. I've got your bio here. I took it off your website. I added a couple of things. So here we go. Dr. Stephen Weiniger helps people stand taller, get out of pain, and move better with strong posture. TV, radio, and online media calls him the posture expert because he leads the posturemonth.org global public health campaign and wrote the book, Stand Tall, Live Longer, which is an anti-aging strategy. Before I go any further, most people wouldn't think that posture is an anti-aging strategy.
Oh, big time it is. Your posture makes a big difference in how your body ages. Think about it. When you think of somebody that's 80 years old and 90 years old, that's aging the way that you want to age, when you get hopefully to that age, are they this person or are they this person? If for no other reason, then when you sit up taller, well, try this. Slump forward like an old person and take a deep breath in.
Not so easy.
Okay, now try it again, but sit taller. And take a deep breath in again. And notice any difference. Breathing is really good for your health. And when you stop breathing, you stop. And posture, when your posture keeps on breaking down, flexing, and as we say, collapsing, your body learns to live with less air, which means you're being less active. You'll have less wind when you exercise. And as we know, exercise is one of the big keys that you can do to change how healthy you're going to be and how long you live. But you can't exercise well if you can't breathe, and you can't breathe well if your posture is folding. Bunch of studies are saying the same thing.
Most people wouldn't have thought it's anti-aging. You captivated everybody's attention in the first 2 minutes. In addition, your company, bodyzone.com, created the free Posture Zone app so people can track their posture over time.
Yes.
Fill me in on that.
Posture begins with awareness. It's amazing when you make somebody aware of posture, the way you said a second ago, and the way right now, I'll wager that a lot of your audience is sitting up a bit taller because we focus their awareness on their posture. And they think they're standing with good posture or better posture at least. If we snuck in and took a picture of them when they thought they were sitting up taller or standing taller, and we showed them the way that they were really standing, not all of them, maybe only 98% of them, but most of them would be surprised by what they saw versus what they felt, because their perception of their body is not the truth. When we look in the mirror, we crimp ourselves up because, okay, now I look good, and then we walk away and we do something else.
Well,
having a picture that's objective that you can go back to is huge.
You know, it's interesting. Before I even finish your bio, we're into questions. So I'm going to ask you this right now. Why is it a good idea for people to take a picture of their posture and for their children and maybe of themselves?
Great question. Because kids are growing, and kids today are growing with devices that are training them to be folded. We did a interview that was on ABC in LA a couple of years ago, and at the end of it, the reporter went to a kid in a mall and took a picture of her, which was one of the things that we've talked about, and then showed the kid, maybe a 11-year-old girl, a picture. And the kid, when she first saw the picture, was like, yeah, what do you want, lady? And then she saw the way she looked. And her eyes got big, and she was like, oh my God. And she would look at it because it engaged her. When you think about it, if you see somebody if you see yourself in a Facebook picture or picture anywhere, who do you look at? You.
Yeah.
But you're looking at it from this way. When you look at posture from the side and you see where your body truly is, because kids are spending so much time in front of a screen, they're training the bodies to fold. And collapsing kids is one of the things that we've been talking about and working with parents to help their kids literally stand taller. Making them aware of it instead of having the lines in the back of the door the way that we did when we were kids. Our parents made lines to see how fast we're growing. Take a picture in front of a grid is best, but just a picture to document so you can flip through what the child looks like. And that's what Posture Zone is good for, because it lets you keep all the kids' pictures in one place of posture, measure the posture, and then see how it looks later on.
Well, where can I get that free Posture Zone app? Because since we talked about it.
Well, if they have an iPhone, an iPad, or Google device, any device, they can download it from the App Store and load it, and the free app is free. Our goal with posture is promoting the idea that you need to take care of your posture, which begins with awareness, seeing what it looks like and showing people this is what it looks like when I think I'm standing tall. It's not about being perfect. It's about connecting your perception to reality and then strengthening that reality.
That's great. It's great. So I got another one here for you. We haven't read your whole bio. We broke it up, but he's trained. Dr. Stephen Weiniger is trained certified posture exercise professional, CPEPS, in 48 states. So I'm going to ask you what 2 states are missing. 27 countries to help people strengthen how they stand, sit, and move with strong posture. Last but not least, Dr. W's book, Stand Tall, Live Longer, which I haven't have read, is available on Amazon.com or BodyZone.com. BodyZone.com is interesting. It's where you can find a posture specialist. So what 2 states haven't you been in?
Believe it or not, Oklahoma. And it's funny you say that because we were talking about getting the other state by having a seminar there next year. It's Hawaii.
Hawaii. Oh, my heart bleeds for you that you have to go there to lecture.
Exactly. But I mean, other than that, I've been in, Rob and I, we're both chiropractors. I've lectured, as you have, for most of the chiropractic associations in the country, as well as around the world. I was in France earlier this year. I'll be in Australia later on this year. And when you talk about posture, people get it. And so Oklahoma, I'm sorry, but we have not been to Oklahoma yet. We have no CPEPs in Oklahoma. So,
well, you know, a big shout out to Oklahoma. Let it be Dr. 15. Let's see what we got with the Oklahoma Chiropractic Association. But to let you know, I'm speaking in Oklahoma next year, so we're going to see what I can do for you there. We got to have all 50. All 50. That's great. Now, 27 countries. 27
countries.
How long have you been at this?
We've been teaching posture since 2004. We've been doing certification since late 2008. So 10 years, 11 years.
And, I mean, you were a practicing in-office chiropractor for many years.
I practiced for 26 years actively, and it got to the point because I started practicing and then lecturing on the weekends and going back and seeing patients Monday morning. And after doing that for 20, 25 weekends a year, seeing patients until 6:30, flying somewhere, doing 12 hours, going back and seeing patients Monday morning, inside of a week, I had 3 friends say to me the same thing. Stephen, you can do anything you want to do, but you can't do everything you want to do. You got to pick. And so my passion led me in the direction that I'm in, and that's what gave me the flexibility to write Stand Tall, Live Longer, to develop the Posture Zone app, to do the posturemonth.org public health website, and to do the self-help stuff with strongposture.com, where people can help themselves, to do Body Zone and some other projects that we're working on right now that are really cool in terms of helping people to improve posture, because it makes a difference and you can do something about it. And it makes you look better and feel better.
I think it's so important because so many of us, you know, you refer to the idea of lecture and everything. It's so important to know that our seeds are in seeing patients. So we know what it's like for one, the public, because we dealt with the public. And 2, we know what it's like to be the practitioner. Some of the things that I get still being in the office, going through some of the pain that you have, is they ask me this all the time. I don't understand how to do the exercise. How can I get the exercise done easier? Help the public and the practitioners now put the exercise in an easy format?
The key to any exercise is focusing on accuracy of motion. And the biggest problem with doing any exercise is that accuracy of motion. In sports, good form is key. Every coach will tell you the same thing. You want to have good form. If your posture is all wonky and you're throwing a ball like this, the ball is not going to do what you want it to do. Your posture from the inside, from the bottom up, needs to be open to be able to move the rest of your body strong. If there's been an injury and you have someone doing exercise, if their overall posture is adaptive, any other exercise they're doing is also going to be compensating for that adaptation. This is the thing that we have a lot of doctors that work with us that tell us that it makes an amazing difference, that everything from back pain to shoulder pain to neck pain, because the first thing we do is connect someone's perception of how their body is moving to the way it's really moving. From looking at what it looks like to focusing on one thing at a time for how it's moving. You can only focus on one thing at a time. Some people say, no, I can focus on two things, and they're turning back and forth. You can really focus on one thing.
The power of the strong posture exercises is that you're focusing on one thing at a time. We use what's called must versus try. So you know what you're focusing on. And then we're sequencing that from one thing to the next along 3 tracks where you're working with your balance, you're working with your alignment, and you're working with your motion. And within each track, you're progressing it. And I literally yesterday got an email from one of our CPAPs in Australia that we're doing a seminar there in November, and actually doing a tour. We're going to be in Adelaide, Sydney, and Gold Coast, which is pretty cool. I'm excited about that one. And she's going to, I think, the one in Gold Coast. And she said that she's really excited because they're doing this with patients, and she's done all this different kind of rehab. But patients like this because they know what they need to do. They get it. And then when you progress them, they get that. So instead of having to come to you like the way that some clinics work, where come in, do the exercises here, and you're doing them well here, but at home you're doing them poorly, you're teaching people how to do it well for themselves by focusing on their weak link. And when something's not working right, if you're a chiropractor, you adjust it, and people can feel the difference. And it's not, well, maybe it feels better. It's, I couldn't do this, and now I can, because we're being very precise about the must. When you're doing a general whole body exercise, you've got 206 muscles and 206 bones and 638 muscles that are all moving in myriad patterns that you can't focus on all that. When you focus on one thing at a time, you can retrain it, make it, send somebody home doing that, or if you're working with the online course, practice that one motion, and then the next time come back and build on it in a very, very, very systematic way. And that's why the people that are doing it on the clinical side, that's why we have people all over the world, because it works. And when people tell their friends, they tell their friends. And now we're getting more requests from people that are asking about strong posture for their family. And like, hey, my son doesn't have back pain. My mom doesn't have back pain, but I've noticed she's starting to slump over. What can she do? And we wrote the book, Stand Taller, for that once upon a time. And now the new strongposture.com website has a self-help program for people to work with themselves.
Well, you brought it up. Is my lower back pain or back pain from my posture? I'm sure I've heard that question once or twice per day.
And people say it because they can feel it. If you think about it, your posture is how you balance your body. No matter what, if you're not falling down, if your body's vertical, your muscles are working to keep your body vertical. If the masses, instead of being stacked straight, if they're pulled off to the side, some muscles are working harder to hold themselves up. Others are being compressed. And posture is not the only cause of back pain, but a recent survey of physicians found that 89% of primary care physicians, not chiropractors, but medical doctors, think that posture is a major cause of acute as well as chronic low back pain. There's a bunch of studies that are reinforcing the same thing, that how you hold your body affects how your body works. And from a chiropractic point of view, the relationship between structure and function. is why chiropractors love what we're doing, because it fits with what they do.
What areas of the spine are most implicated in the posture breaks? And if you even want to throw in some muscles. So is it the neck? Is it the thoracic? Is it the lumbar?
In terms of weight bearing, where most pain is, the head, the torso, which includes the upper extremity, the pelvis, which balanced on the lower extremity. So the connection between the torso and the pelvis is where there's a lot of pivot of the whole body being supported. And if the torso is deviating from where your body is standing, which happens when your posture is leaning forward or off to one side, muscles are working asymmetrically, putting more stress on the joints, and that makes low back pain. The other common area is if your head is translating forward of your torso, which is the big issue with whatever you want to call it, but Technic, forward head posture, the muscles in back are, again, working like guy wires constantly to hold you up. But your perception is, no, I'm standing straight, even though the picture shows that you're not. So you may say that, well, I just have a lot of tension in my life. That's why my neck gets really tight. That's why I've got headaches. You're using your body in a way that you can make it work if you need to, but it's not working efficiently. It's not working effectively. And you're going to have more problems, especially as you get older.
So you mentioned Technic. 2 questions on it. Is it real? And do you have a correction that you would want to share with everybody?
I hesitate on the is it real part because it is a real problem, but a lot of people are making a pathology out of it, making a disease out of it. And it's not a disease in the sense that your body will do whatever it can towards what you tell it to do. If you tell your body to move in a way that is mechanically dumb, it's going to get better and better at moving in that way. So if you're spending all day long on a phone or device with your head slumped forward, you're making the muscles work in that direction. So doing an exercise can help it, but this is why it's important to look at your habits as well. Before we even do any exercise, any strengthening, because a lot of chiropractors say that chiropractic can help the symptoms of Technic, and that's true. But if you don't change the habits and they keep on doing the same thing, the problem keeps on coming back. So to begin with, if you've got a device, if you've got a phone, instead of holding the phone and looking down at the phone or holding the phone to your chest, learning how to hold your shoulders up, back, and down, to drop your shoulders and lift your arm up so the phone is in front of you. It means you're working the muscles in your upper back. You're opening the muscles in your chest, and you're keeping your head more level. That posture pattern is what you want to be teaching people in what they do in everything in life. And that's one of the things that we focus on, creating an awareness of how you think you're standing at the beginning. That's one reason to take a picture, to see what your resting everyday posture looks like. In terms of exercises for Technic, the one that studies have shown makes the most sense is doing a straight neck retraction. We can add some things to it along the way.
So is sitting really the new smoking?
Again, sitting is a disease in the sense that it happens from what you're making your body do. But that said, it really is a bigger problem. And one of the coolest studies that came out was by a researcher named Biswas. And this was published in the Annals of Internal Medicine, which is a tier 1 journal. It's the real deal. And he did what's called a meta-study, which is a study of 47 other studies, and pulled all their research together and came away with some astounding findings that people that were sitting for 12 hours a day for 10 years had a 91% increased risk of type 2 diabetes, a significantly increased risk of mortality, problems from a cardiovascular point of view. Because when you think about it, if you're being folded for hours at a time, you're compressing the lungs, you're also compressing the internal organs. And this has an effect on health. And the most interesting thing about this was even though if people exercise, it reduced some of the effect. So people that exercise reduced their risk by about 30%, which means that 70% of that mortality risk that this was found which was significant, was still there even if people exercise, because like a piece of paper that's folded, once you're folded, your body tends to keep on working in that pattern. That's why it's so important. If we're living in a tech world, and we are, we're living in a world where you need to be in front of a computer for long periods of time, which a lot of people are. Learning how to change your awareness of your body, retraining your control of your body, and building a good posture environment is key to taking care of your postural health if you want to not have problems later on. And in terms of the new smoking, which I didn't answer the question, the risk factor of dying from the diseases that Biswas was talking about was just a smidge lower than the risk factor of dying from moderate tobacco use. And that's where it comes from, the sitting is the new smoking. So it really is something in the sense that smoking used to be an innocent thing that everybody did, and now we know that it's way more dangerous than people thought. Sitting is way more impactful than people think.
Sitting is the new smoking. I happen to be sitting during this podcast. Normally I stand. But it's funny. So many people ask me in practice about, can I get a standing desk? I actually have one here, goes up and down. I know you've talked about stuff like that, but the real question that everybody asks, and I need you to answer it. Hey, do I need, Dr. Rob, Dr. Steven, do I need a brace to help my posture, to pull my shoulders back? What do you say?
I think if you want, as a chiropractor, if you want to need to see me all the time because you're creating a problem, that's a great idea. If you don't want to need to see me, if you want to take care of yourself, a brace is a horrible idea. Once you give somebody a brace, the muscles get weaker. The muscles don't want to, if you make a muscle not have to work, it doesn't work. If you ever broke an arm and had an arm in a cast, when the cast came off, your arm was all weak and shriveled. If you put a brace on the back to hold your shoulders back, you're telling the muscles that should be doing that, take it easy, you don't have to work anymore, I'll do this for you. And all the people that are selling and hawking things like that say, hold this back and do exercises. If you did the exercises, you don't need the thing to hold you back. You want to strengthen the weak links. You don't want to weaken the weak links.
So let me get this straight. A little summary before I got a couple of questions for you. Number one, take a picture of posture, care about your posture. Posture is health. Posture is good posture is anti-aging.
Strong posture. It's not, I don't talk about it being good and bad because your body is shaped different from my body. You've got, somebody looking at you might think that, my God, this guy's got his head not quite where it should be. But there's a reason for that. That is the way your skeleton is formed.
Mm-hmm.
And trying to make that good posture is not going to happen. So we can either take you out back and shoot you, which I'd rather not do, you're a friend.
Thank God.
Okay. Or we can look at that body and say, how can you strengthen it to work as well as it can? So what does that mean? It means towards symmetry, towards aligning those posture zone masses of head, torso, pelvis, which when you think about it, if you've got 4 points in a line, when you align them, that line becomes longer. Or if you're standing up, taller. That's why the direction for strong posture is not good. Posture is not good or bad. Posture is strong and weak. And when it's weak, it starts to collapse. How can you tell? Look at somebody. Is their posture long or collapsed? And that's why I don't like the phrase good and bad, because it puts a label on a lot of people that is wrong and makes it where, well, I can't do anything about it. That's just the way that I am. You can always do something about it. And the more you're having a problem, the more important it is for you to do so if you want to live longer.
So strong versus weak posture. Always go for the strong posture. Everybody can always improve. Everybody should work about it. Strong posture is anti-aging. Try to stand and not sit, move. The brace is a no bueno. That's an out.
No bueno.
So, okay. What can everybody do to care for their posture? Give them a couple of things.
Okay. In terms of caring for your posture, we talked that there's an ACE strategy. ACE stands for ACE, your posture, awareness, control, and environment. Take an annual posture picture, or twice a year, or 4 times a year, but be aware of what your body looks like from the front and especially from the side. And try to do it in the same place. Have a friend or your significant other do it against a door, or go to a CPAP to take a picture against a grid, like the grid behind me.
Yeah, I was wondering what that was.
It's a standardized way that professionals use to benchmark where posture is. And we suggest using the Posture Zone app, because that lets you then measure where the head and torso and pelvis is, how it's deviating from where you're standing in a very standardized way. And it's simple. And there's other things that professionals can do with it as well, or that you can do if you want to look at sports performance, but that's a whole different day's dialogue. But be aware of what your posture looks like. For a lot of people, that by itself is eye-opening. Being aware, taking control. Taking control means trying to stand taller and doing some exercises to improve your control. Things like yoga, Pilates, or the things that we teach, strong posture exercises, are all motor control exercises that focus on precision of form. And the strong posture exercises are a simple way that even people that are yogis that we've worked with, and the people that teach Pilates and yoga, tell us makes a difference in their form. Because when you focus on one thing really tightly, you can then see subtleties that you otherwise would miss, and then build on those subtleties. Heck, that's what chiropractors do when we're working with the spine. When you're adjusting somebody, you're affecting a subtle movement. And the awareness, control, environment, that's the E. Building an intelligent posture environment. Things like having a desk that's a stand-up desk. But I also add, you want it to go down as well. A desk that moves up and down lets you keep moving. Your body is designed to move. That's the first posture principle. So awareness, control, environment, doing basic exercises to strengthen your posture, and being aware by taking a picture and then taking another picture and compare it and see how your efforts have made a difference in how you look, how you feel, and how others see you.
That's great. So you've definitely created an awareness for posture, strong posture. There you go. How can how can I get in touch with you? What are some of your social media sites, your website, all that kind of stuff? Share that with everybody, please.
I'm Stephen Weiniger, and if you search me on Facebook, on Twitter, you go to Posture Practice. Actually, you know what? You've got the things, flash them on the screen. I don't have it in front of me.
I got them all. We'll put them up. It's been my pleasure. We have to do this again. I look forward to seeing you real soon, my friend.
Rob, it's been a pleasure. I really enjoy the dialogue, and I look forward to connecting along the road.
Absolutely. Everybody, Dr. Rob, Dr. Stephen Weiniger, always yours in health, proven health alternatives.